And few words about Caelestinus. It's a collaboration of 4 partners, where InterSystems is a technology vendor. ICAM, it's the largest transplantation hospital in Central Europe. Czech Technical University, and CE Hacks as the operational team. And today we have 22 startups residents in Caelestinus. And 5 of them you will see here. They will present they will do their pitch sessions for you just in 5 minutes. A few words more. So what we provide InterSystems cloud services. It's FHIR Accelerator service, Health Connect Cloud, and FHIR message transformation services. And all these startups, they use InterSystems cloud services with their innovations. And I now invite Dean Andrews. Dean Andrews, first of all, he's my boss. Yeah. And Dean manages all the strategy of about startups and developer ecosystem. Dean.
Focus on making it easy for startups to innovate on our technology, and what you're about to see is a great example of that. This is the first startup accelerator that we've been involved with, but we're amazed at the work. And we are looking to learn from this experience and then to participate in startup accelerators in the United States and other parts of the world as well. So just stay tuned for that. Enjoy these presentations. It's pretty awesome.
Co-founder of Caelestinus, and actually head and the leader of our Czech partner. They're making all this possible. So, Tomas.
Hi, Evgeny. Thanks for having us in Seattle at this wonderful event. I just want to tell you that this session right now is a special one, because if you ask a question, not any question, but a relevant one, after the pitches, like a decent question, you get this T-shirt, and there are only about, I don't know, 7 or 8 T-shirts in Seattle right now. So don't be afraid to ask questions. Just make sure you fire it immediately after the pitches. I promised to Evgeny that I won't be more than 1 minute. I lied. It will be just under 2 minutes. But I wanted to tell you something about the name, Caelestinus. So any guesses? Anyone? Does it ring a bell? He told you. Yeah, exactly. Yeah, we are making new stars that will shine on the sky. Not Lucy, but the teams in the sky. And that's, of course, the explanation that you were given. But there is a deeper story. And in fact, it comes from a first name of a guy called Caelestinus Opitz, who lived in Prague. And he performed the first surgery under anesthesia in Europe, in fact. And no one knows about this. And it happened in a hospital in Prague. And there was allegedly a lady that stuck her hand, unfortunately, in some sort of machine. And he applied anesthesia that he tested on mice. Then he tested on his brethren in the Order of St. John of God. And then he finally, in 1847, he applied it for the first time in Prague, in Europe. He wasn't number 1. That was American, of course. But there was only like 3 or 4 months between them, and they didn't know about each other. So that's why we adopted his name. We want to build new health tech heroes, as that guy in 1847. And we have for you 5 great teams that come from around the world, from Central Europe, Israel, other countries. But this is for the first time that hospital partnered with an IT company, a data connected data company, and hackers. So actually they invited ethical hackers to help them deal with the issues, and some of the teams that you are going to see today actually originated at a hackathon in a hospital. So enjoy the show. The first one to present in 8 minutes. There'll be 5 minutes pitch and 3 minutes question time. Your chance to get the t-shirt. So let me invite Longevica to be the first ones to pitch.
Okay. Thank you. Hopefully you hear me well. Yeah, since I'm honored to start this session today, I'd like first to say, thank you. I'd like first to say on behalf of the whole Longevica team, and of course all the colleagues here from the Incubator, huge thank you to all the InterSystems guys. Thank you so much. Thank you. And our story, our mission is fully aligned with what we heard today from the keynotes of the leaders of InterSystems. We are essentially building a leading data-driven, end-to-end healthy aging platform for personalized and value-based senior care. And the aging problem is really tremendous, and we are going through the unprecedented shifts in the population here. And what it says basically is that we have tens of millions of patients who have multiple chronic conditions. And this is unprecedented. And which means there's a tremendous pressure on the healthcare system and, of course, acute lack of personnel. And what we want to do basically is to help hospitals to get into the untapped markets of the remote healthcare, firstly, and then empower nurses and physicians to scale up their operations in basically manifold, in terms of number of patients they cover, while providing even more personalized, empathetic, and rewarding care. And this is really complicated thing. So here is our platform. It consists of 3 elements. So first, we score the patients. We come to a hospital and score the patients at scale. And then, based on the scoring, we prioritize the patients, and we choose the right personalized care plans for each patient. And then we have a device at home, which sits at home of the patient and monitors adherence. And the health aging index we're getting from the Wake Forest University. This is a leader in geriatrician. And it basically is scientifically proven, and it is clinically validated and shows clinical benefit. Care plans we get from the hospitals, and the digital nurse does 2 things. It provides engagement for the patients, and secondly, it collects data. And once we collect data, it feeds back into the platform, and we can, using AI analytics, we can identify that some of those care plans actually do not work. They are not efficacious, and we find the best ones based on the health aging index for each particular patient. So that's how it works. And at some point, of course, we can make our own care plans. And the time is actually right now because we have now 100% of hospitals due to pandemic capable of doing these remote healthcare services. We have FHIR as a standard. And finally, we have new CPT codes, reimbursement codes for this remote patient monitoring, remote therapy monitoring. Which are these codes are introduced this year and last year, and they are ridiculously underutilized. Less than 2% are being used. And even with this underutilization, the market size, even this year, is already over 4 billion. And this will grow rapidly to over 14 billion within the next years. And our business model is very straightforward. So what we do, we partner, we integrate, and implement. So we partner with the largest hospital chains, and then we score the patients, we take the care plans which they have, integrate them on our platform, and then we help the hospitals implement this, efficiently, automate that most of the time, and then help this implement this both at home and at the hospital. And of course, we get the percentage of reimbursement. That's the business model. And we, of course, the market is huge, so there are a lot of competitors going after this market. Like this below, these are kind of like lifestyle driven, so they don't have this clinical validation of the data, whatever. Here on top, we have really a lot of companies which are really good, healthcare driven, like great companies. But this is a paradox. We have a lot of data, we have a lot of innovations, but they don't get into the hospitals, all these innovations. Because these are normally some point innovation, like automating something. And this is normally too many of those companies to integrate for the hospitals and to handle. So, and we're trying really to be end-to-end solution and integrate all of those, and potentially these can come to our platform. And if you look at specifically at those companies who do remote healthcare, they don't have this healthy aging index kind of concept, and they are not using AI, and they do not have the ambition to integrate all of what is already available. So they are doing something themselves. Here's the team which we have here. We have a great mixture here of people with serial entrepreneurship background, like multiple exits. We have people who are experienced in large-scale operations in Walmart, in Sanofi, and others. We also have a geriatrician here who works directly with Rockefeller University on a few things, and Emmanuel here, who is the founder of a device company who he sold to Stanley Black & Decker. And myself, I'm a venture investor, having 5 companies going public over the last 5 years and creating $3 billion of exit value for my investors. So this is the team. And finally, we're acting in strategic partnerships with a few players. We are acting now, of course, with InterSystems. And I think we're using the whole range of the solutions which InterSystems has in store. And we are very excited about that. But we also, I mentioned we're working with Wake Forest University, which serendipitously was acquired by Atrium Health last year. And now, like a few weeks ago, they announced merger with the Advocate Aurora, which creates one of the largest hospital chains in the US, which we are currently, it's great to be part of that. Yeah, so this list I open up for today's discussion. So if you want to partner us on our basically mission to provide the right care to the right patients at the right time, feel free to come over to us. Thank you so much. Thanks. Can you
Yeah, question?
Yes, well, yes, we do the servicing. The way, first of all, that it works is that we send it directly to the home of the patient. We get from the hospital system, we get their contacts, and we send it into the home of the patient. If there were problems for the setting up and for the use, we would be following that directly with them. To the fix, I mean, right at the beginning, to scale up, we may want to eventually partner up with somebody that helps us with the servicing, but at the moment we're doing it ourselves.
We have last 30 seconds.
The company would be part of some larger corporation at the time. Yeah.
Okay, we are out of time. If you have questions, you can catch all the teams outside. They have their demos set up and ready, so you can talk afterwards with specific questions. And now big clap to Longevica.
Yeah. Thank you. Thank
Dmitry.
you. Thank you.
And here's your T-shirt. It's the right size for you. Maybe you have to do some work, but it's the right size. Our next team that I'd like to invite to present is MedMe.
Ladies and gentlemen, I'm really excited to be here, and let me start from a question to get my free T-shirt. Okay, so how many of you actually ordered some airline tickets by phone, or just got your hotel confirmation by fax? Only one, okay, but it's weird, but it's very funny that this problem still exists in medical sector. Patients still book appointments by phone, and medical documents are exchanged by paper scans and even in the US by faxes. There are 2 reasons for that. First of all, very strict regulations, and the vast variety of medical information systems prevent one from creating one centralized database, and also how to persuade clinics to transfer their soul-sensitive data to third-party systems. But there is a solution. MedMe creates one and secure channel of communication for all of medical organizations as long as they are partners, like pharma, insurance, and other companies. So what was before? If you look at the diagram on the left side, we have some clinics all hidden behind the wall of EMRs, and on the right side, we have their partners. If we are going to integrate only 100 clinics with only 100 partners, then we need to create it to support 10,000 integrations, which makes it practically impossible. And where here MedMe comes into the picture, it not only allows one single channel of communication, we also have plenty of solutions for different types of organizations, patients. For example, for clinics, we have PRM systems that manage patient flow and all the resources. For patients themselves, we have like personal cabinet, appointment scheduling. We have B2B cabinet to allow seamless communication between clinics and insurance companies. And we have solutions like telemedicine and the alpha version of real-world data marketplace for pharma. So our business model, our current business model is pretty simple. We charge clinics between $10 and $25 per month per licenses. And our scaling partners are pharmas and the insurance companies who would like to get one big like solution, a channel of communication for any of their partner clinics. And our new model, we are going to create smart on FHIR apps that will allow a patient to be in the center of the picture, and the basic version will be free for them, while pharma will pay for real-world data. So we are going to double our sales this year. We doubled our sales previous year, and actually we are going to grow even more. So right now we look for $500,000 CLA bridge loan just to scale sales in new locations. And within 6-9 months, we're going to raise $2.5 million as a Series A round. For such great plans, we have a close-knit team working together. Here's Fadi, my partner, raise a hand. The tallest guy in the room. We have guys like Titsko, who actually designed 2/3 of Israeli medical information systems. I also made my exits before, so a little bit experience. And we have a guy like Krish, who helps a lot with development in Southeast Asia. So just to remind, MedMe is electronic health record, appointment scheduling, and e-prescription platform that allows to connect clinics, pharmacies, insurance companies, and all other players. So join us to rock medtech market. Thank you.
Okay, I think that's it. Thank you,
Thank
Alexei.
you.
MedMe. Thanks. Maybe you understood. So we have teams that are startups, companies that grow, that want to scale. And thanks to partnership with InterSystems, they can connect well in the States and around the world. And you can participate either as an investor, partner, client, mentor in this new revenue stream future for the startups and their partners, which is not just InterSystems, but also hospitals and other investors that are going to back these teams. So if you know, if you are an investor or you know of somebody who might be interested in getting bright talent in the US and the rest of the world, just make sure you then connect with the teams outside, and you can take the conversations from that. We have 3 more teams, so I'd like to invite Mild Blue, Tomas, to join me here and present what you've got up your sleeve.
So hello everyone, my name is Tomas Kouřim. I'm the CEO of Mild Blue, and today I'm gonna introduce you Health Warden. You know, let's start talking about money, because healthcare is about money, whether we like it or not. And it's actually pretty expensive. One of the most expensive part of healthcare is staying in hospital. One night at the hospital costs about $2,500 US. Compared to the stay in the Hyatt, it's about 10 times as expensive as being here. And I don't know if the services are that better. But most of the time, the money is worth spending because it saves the lives of the patient. But sometimes it's not so obvious. And thus, doctors face a tough decision. Keep the patient one more night, make sure everything goes well and everything is perfect, or just send the patient home, free up the capacity, save some money, some resources for someone who might need it more. Now, what if there would be a tool that could help you do both? Stay in touch with your patients and free up your capacity and open up the funnel. That's exactly what HealthWarden does. HealthWarden is an application that shortens the hospitalization time, application that provides smooth and easy communication between the doctor and the patient. Communication that is fully controlled by the doctor and personalized for each and every patient. It's driven by AI, allowing to trigger early warning before a problem occurs, not after that. It's able to predict if a patient might need a hospitalization, if there might be another problem, and prevent actually this problem from happening before it occurs. The application, of course, provides very valuable data, be it for science purposes or just for regular checkups. It runs on FHIR. It can be integrated into any EHR systems. It's optimized for the elderly, which is very important. And of course, it's safe and secure. Now, I will give you one example how HealthWarden can help the patients, the hospitals, the healthcare systems all together. TAVI is a modern procedure, transcatheter aortic valve implantation, procedure where patients get new aortic valve through a catheter, which is crazy from my point of view. This surgery is being more and more popular, and only in Europe and North America, there will be almost 300,000 TAVIs every year. And what's interesting about this procedure is that sometimes the patient goes home immediately after it, the same day. And sometimes the patient stays up to a week in hospital. That means that it's 0 to 2 million hospital nights just on TAVI. And if you go back to the first slide, it means 0 to over $5 billion spent on hospitalization for those patients. HealthWarden can help shorten the hospitalization time by 1 to 4 days, and thus save up to $2.8 billion every year on just the direct costs connected with TAVI just in Europe and North America. And that's a huge amount of money worth saving, and that's just one procedure, one single procedure out of tens or hundreds of procedures which can be utilized and optimized using HealthWarden. There is a strong team, strong motivating team behind HealthWarden, team of MildBlue, which is a company that creates algorithms that save lives. Thank you for your attention.
So we have three questions, so let's go 1, 2, 3. I'm not sure we can do 4, but we'll try. So, please.
Yeah. So during the pre-surgery phase, the patient gets the application installed on his regular cell phone. It gets it's introduced into the application, get some a course, a quick course on how to use it, and then the application prompts the patient and asks questions, suggests to do some activities, submit information, answer questions, etc. So the interaction is through a mobile application.
Actually, Nikolai took one of my questions away from me. Thank you, Nikolai. So, as far as I understand, the application is actually fed by the data by the patient himself.
Yes, partially the application, first of all, gets data from various wearable devices. Watch.
Is it everything medical device certified?
Well, it's more complicated. Yes and no. In the end, yes.
So it means if there is some data actually collected from the devices or from the patient, the doctor gets some warning that the patient is getting worse, or
Exactly.
is it covered and paid by the insurance company that the doctor spends the time looking at those data and evaluating if the patient gets worse or better?
Again, that's behind the scope of this 30-second answer. It can be. It's not that straightforward to be it for all.
No, because what is my concern if a patient fills the data into the application and maybe he only feels strange or he feels dizzy, somebody immediately hospitalizes him or somebody will make some decision based on the feeling of the patient, maybe decision.
Well, that's what you do. If you feel dizzy, you call ambulance and you go to the hospital because you have some strange feeling. And that's the same with this.
Last minute, so there was one more question.
So I think you answered one of the question of like, how do you allow to connect this, and also like how accurately you can predict that the patient will have certain problem, like do you have any data to kind of showcase that and your experience with your model, whatever you are using?
How are you different from thousands of applications that do remote monitoring and patient-reported outcomes?
Focusing on the patients, but on the doctors. And the doctor is the main user. And the doctor uses the application. And patient is just the, not to say device, but like just the mediator of the application. The doctor is the user.
Okay, so thanks, Tomas, for your presentation. Mild blue. Reducing time one needs to spend in a hospital. I think that's what all we need. Okay, we have 2 more teams. It's now my pleasure to ask Nanteo to reveal the origin of the name, the meaning of life.
I hate going to the doctors. I actually have problem to make the appointment because I have to call there. I have to make the time for it. I'm not able to work. Then I have to find a parking spot. Then I have to hope I'm not gonna get a ticket. And then when I finally got there, I have to wait in a waiting room full of ill people when there's nothing wrong with me. Because of all of this, I keep postponing my doctor's visit over and over again. Okay, but what if something does hurt me? What if I feel blue or my stomach hurts or something like that? What can I do then? I have 2 options. I can either go to the doctor, which I hate. I am too busy for that. I also believe it's not that big a deal to go to the doctor, and I believe it's gonna get better by its own. So I have another option, and that is going on Google. I think I don't have to explain to you that is not a very good idea, because the only thing I find out there is that I have all the deadly diseases of the world, plus I have more symptoms than I had before, because after I read them, I also have them. Because of that, I also underestimate my prevention again. It's not only me who does that. Actually, 85% keep underestimating their prevention even though their family history. That 90% of doctors recorded a lower number of patients since COVID started because people are worried that they're going to get sick while waiting at a doctor's office. I believe that all of us know that the underestimation of preventive care leads to more difficult treatment and an increased chance of death, but yet we still do that and we still keep underestimating taking care of ourselves. Actually, 40% of death in the United States could be averted through better prevention. So this is the reality, but it doesn't have to be the future. In Nanto, we aim to change the way how people approach their healthcare, and we want to show you that taking care of ourselves can be as easy as making a coffee in a capsule coffee machine. Instead of trying to get you to the doctor, we aim to bring prevention close to you by creating Malia points. This would be possible thanks to our device called Malia, which will give you your health results within 25 minutes. Here on this table, you can see our device, which is our second prototype, and we are already working on our third one back in Czech Republic, in which all the errors and bugs will be fixed. Now, there is probably a question, how does this work, right? So imagine this, you feel blue, your stomach hurts, or you feel completely fine, you just feel like you want to improve the quality of your life. Now, instead of Google, you can go to the closest Malia point, like for example, pharmacy, gas station, or something like that, get tested, and you are free to go. Your health results will be automatically sent to you and to your doctor as well through a FHIR and InterSystems within 25 minutes. Like this, you and your doctor can analyze all of your records and you can have the results anytime when you need them, what would improve your healthcare and would also make your doctor's job easier. To be clear, we don't aim to replace doctors, we aim to support them to give them more information for better decisions. The whole process of testing, we like to compare to the process of making coffee. I believe that all of us know how this works. So imagine you have a coffee machine for a capsule and you have the coffee capsule. If you want coffee, you insert the capsule in the machine and you have your coffee. With us, instead of the coffee machine, you have this device. Instead of the coffee capsule, you have our testing cartridge. Plus, with us, you need small sample of blood from your finger and you have your test results. Right now, we are searching for a partner as well as for an investor who would help us to create first Malia points because prevention is better than cure. We will really get to love in touch with you. We would love to tell you more information about us, so please feel free to contact us. We will love to have you tell you more. Thank you.
I can speak quite loud, but okay. Which kind of tests do you do from the blood? Some biochemistry or microbiology? Which kind of tests? Because I don't know what you mean by prevention. Is it, how to say it, targeted prevention only for some diabetes, or which kind of test this machine can provide?
Yes, you said it. It can be diabetes, but we can analyze antibodies and antigens. Right now we have, is it working? Yes. Right now we have one parameter, it's adiponectin, that's for diabetes. We don't aim to do diabetes because there's faster and smaller devices for this, but this parameter works for us, so we are able to analyze that this device is working. We can compare it with the big devices, and we can say, yes, this device is working as it should. We are working with a partner who would do the chemistry part so we can have faster and more tests at the market as soon as possible.
Okay, so it's now something like a substitution of the simple glucometer?
No. As I said, we don't aim to do diabetes. We have this marker because we have partner who can give this to us, so we can compare our device and the big laboratory device. But we have second prototype, we're not on the market yet, so we have to develop another markers, and that's what the partner will help us with.
But I suppose it also has to be certified as a medical device,
yes.
Class 2A.
Yes.
Is it already?
No, it's prototype.
It's prototype.
Yes.
Okay.
Okay, let's have another question.
Yeah, that was my question too. But just out of curiosity, how does the patient kind of set this stuff up? Is insurance involved? Is it just like a personal email and it's totally outside of the medical system? Is it connected to like MyChart where, we have these kind of medical records between that they could share between the hospital systems? Like, how does the patient get registered in that piece?
Okay, so this is not final decision yet, but we aim to do to be connected with an app. So you can register on the app. It would generate you QR code. You could come to this device and you can scan the QR code. So the device knows who you are and who to send this to information. Then get tested and you can go. Okay, welcome.
Also, I'm curious how much blood draw it requires, and like, is there any kind of efficient way you are like, like are you trying like any innovative way to do the same test within like using the less amount of blood? Because now I don't think it's done under supervision, right? It's patient is taking blood themselves. Yes.
Yes, it's made for self-testing. We had somewhere small needle you can use it for. So it's a small blood. It's like 10 to 20 microliters. So it's small blood, but a little bit bigger. Thank you, Honza. You work awesome as a hostess. Well, it's a needle. It hurts a little bit.
Yeah, we have like 10 seconds, so
all right, quick question then. Where does the device live? Is this an individual patient who has it? This is at a shop, my drive-through gas station? And how in that context do I validate that the person whose sample I'm testing is in fact the person whose record it's being tied to?
I am sorry, I didn't hear you correctly because Guy have to talk. But the first part was where is the device, right?
Yeah, where does who gets the device versus who uses the device?
Yes.
And then the follow-on on that is how do you validate that the sample being sampled is in fact the patient being attributed to the sample?
Okay, I see. So the device would be in the Malia points. So we aim to have it on as many places as possible. So it would be like pharmacies is our first focus. Then a gas station, so you can have it when you're going on work. So you can just stop and then continue. So this is this. And then it has two readers. It has the reader for the QR code, so it identifies you and your profile. And it also has reader of the cartridge. So when you insert it inside, it identifies the test. So it connects those two information, and you have the information about who is tested and what kind of test is it doing. Did I answer your question? Well, I think there are gonna be gaps for startups.
Okay, so that is Nanteo. Thanks for your presentation. And we have last team to present, and even though they are called virtual lab, it's going to be quite physical, the presentation, hopefully. Yeah. So virtual lab.
Thank you. I'll try to be not as much physical with you, but I'll try to have the physical presentation. Okay. So FHIR ICU, it is a virtual training environment in which you can raise a confidence of medical staff, in which you can speed up the decision process the medical staff has in a crisis scenarios, in crisis situations. It is a solution that helps you maximize the potential of the devices that are used on the ICUs and other parts of the hospitals. And also, and most importantly, it helps you save or keep the patients safe, because you can save real lives thanks to the virtual trainings. So now, we were visiting hospitals, we are working with them, and we bumped into several problems. One of those problems were that 50% of procedures that need to be learned on the ICUs or in the hospitals altogether cannot be learned without a real patient or without the patient being connected to the machine. So quite a lot of things that need to be learned are just learned only by talking, or doing it with a real-life patient, which is quite scary for me. Then other problem was that 30% of medical device manufacturer or medical device manufacturers are doing trainings, and on those trainings, usually only like 30% of the trainees stay. So if I want to learn or teach something to a group of medical staff, most of them have to go somewhere because there is some kind of crisis, because they are working in the hospital, there is always some kind of crisis. So usually it is quite complicated to teach them something in real life because they don't really have time. And also there is quite a big fluctuation. That's why we started with the ICUs, because ICU staff is something like a special unit in the hospital that has really the best knowledge on different devices and different procedures. So with all these problems, we decided to create a VR ICU, which is a automated training that helps to train medical staff in different procedures, in different device operations, and in cooperation. Specifically, it's, as I said, it's not a general training, but we are working with device manufacturers. And thanks to that, there are specific trainings that when a medical staff goes through these trainings, after that, they can actually go to a real-life machine and set it up. Like there is a one-to-one copy to it. So that's the main idea, that when they learn something in VR, then they can use it in real life. Also, there are remote trainings. So for example, if there would be a problem that they wouldn't be sure about something, a trainer from the other part of the world would join remotely, and they would talk together like in a real life. Why virtual reality? I don't know who has a experience with VR here. Okay, so let's say about 50% of you. Usually, that's how it goes. A few years ago, there were usually like 1-2 people. Then it got up, and right now it's 50-50, and usually people know what virtual reality brings. And these things are quite impressive, because there are many studies that confirm that virtual trainings for the procedures trainings are 30% more effective, time effective, and also thanks to learning by doing, you can remember better the training, and you can use it. You aren't afraid to use it in real life. Then you can use it anytime, anywhere. You can use it without a real device or without a real patient, so you will not hurt anyone, you will not hurt yourself, you will not break any machine. There are many different advantages of VR trainings. And also, which is a very important thing for the hospitals, is that there are analytics behind it. So when you go through a normal training, you don't really know how the medical staff did good or bad, or where was the problems. In virtual reality, it is a software, so you can tell what was the crucial point that was hard for the trainee, and which kinds of trainings they need to do more often, because they would then need to use it in real life. All these things are advantages of virtual reality, and there are many more advantages, because we don't have that much time, so I will not go into the details. For the VR ICU, our target groups are basically two: the users of the VR ICU, so the hospitals, simulation centers, and the universities. And the second group are the manufacturers of the devices. For both these groups, VR ICU is really, really useful. For the manufacturers, the most useful part is that they have a standardized training. So when they need the doctors and nurses to learn something, they know that they will learn the procedure the right way. And also for the universities and hospitals, there are the advantages of having the real experience. Also, we connected the VR ICU to a FHIR, where we gather information from the VR ICU. we send it through the FHIR into the HR system or shift planner. So when you plan shifts or when you need to see which employees did what training, you can see it just by a quick connection in your own system. Yeah, so this is basically it for the VR ICU. Thank you for your time, and I'm looking forward to the questions.
We have 1 and 2.
The virtual ICUs, how complicated or difficult is it to match the virtual one to a specific ICU that a facility might have? In other words, my ICU may have the same stuff, kind of, but not necessarily laid out the same or necessarily the same equipment as next hospital's ICU. So how hard is that to configure?
Yeah, if we're talking about the layout of the ICU, that usually isn't that important for the trainings, because usually there's the bed and around it there are machines. So that is actually something that is also trained in the ICU, how to set up the machines so it makes sense. Because I know that usually the patient is connected to several machines, different machines. So the layout of the room isn't that important, but if we are talking about the layout of the machines, that's what we are working on right now. We are cooperating with Bear Brown, Fresenius, Hamilton, Lynette, and we are in talks with other manufacturers, and that's what is our goal, to get as many manufacturers and as many machines as possible. And thanks to that, if we come to any hospital, the VR ICU will be the one solution that they can use to copy real devices they have and then use it for the training.
For the staff, thank you. For the staff to consume the training, do you need a specific virtual reality device, or is it supported via iPad or desktop computer, anything like that?
Right now, we are working with VR headsets, MetaQuest, because they are the most efficient ones, so they are the easiest to use and the cheapest ones. So for each hospital, it's basically no-brainer to buy these things, and that's what we are using right now. But we are not like sponsored by Meta, so we don't really care which solution would be the best. We already have other solutions that are multi-platform, so they work on different types of devices, and I think that would be the idea for this also, that it would work on different devices.
There is one more. Yeah, was that a question? So.
Sorry, I just have a quick question. How many scenarios do you guys train on, or
like right now?
Yeah.
So if we're talking scenarios, there is quite a lot of them, because, for example, for the Lynette bed, it is a like one-to-one copy of a simulation. So actually, anything you can do with the bed, you can do in virtual reality, like in real life. Anything you can do in real life, then you can do in virtual reality. So there are like I don't know, like maybe up to 100 scenarios only on the Lynette bed. But we have other like machines, so hundreds.
Oh wow, yeah, it's cool.
So I'm afraid that was the last question of today's session that presented Virtual Lab, Nanteo, Mildblue, MedMe, and Longevica. Thank you. Thanks to all the 5 teams. You got a taste of the teams we have in Caelestinus under incubation. There are other 17 teams that are gradually moving towards prototype and investment phase, demo day that we are planning next week, and also in autumn, where it takes a bit longer. Thank you for being part of this. Thanks a lot. I hope you enjoyed the show. This is like a pilot project. It has never been done before. This is first time we do it, thanks to InterSystems. And I'd like to ask Evgeny, maybe if there is a final message or a call to action you would like to make.
Yes, thank you everyone for being with us. And you see, our approach with startups is very easy. We take the most innovative products in InterSystems, our innovative technology, and invite innovators. And we see, you've seen the result. And so stay tuned. And as Tomas said, we are very welcome to join us on a demo day next week. and another demo day in autumn, and more. So stay tuned with. And yes, and do innovations with InterSystems.